Put simply, telehealth is the delivery of a health service across a distance. So a good example of telehealth may be if a patient has a video conference appointment from their home or from a regional hospital directly to a specialist at a main city hospital. Telehealth can be also delivered by using the simple telephone, also by sharing information. For example, sending a digital image by email is another good example of telehealth. Often we think of telehealth as a method of supporting people in faraway places. However, telehealth is just as useful for people who live in city environments. Telehealth is not designed to prevent all travel to a specialist. While telehealth can be extremely useful for a range of appointments, such as follow-up appointments, the choice of whether to provide service in person or by telehealth should be based on the clinical requirements and the purpose of the consultation.
Research shows that the assessments and diagnostics performed via telerehabilitation are equivalent to in-person services, and the treatment outcomes that you can achieve via technology are not inferior to traditional services.
Our research debunks this myth by showing that the virtual delivery of healthcare is experienced differently by clinicians than in-person delivery. Importantly, telehealth requires adaptation work and the learning of new competencies by clinicians, and changes the dynamics and interaction between those involved in delivering health services.
Well, contrary to what most people expect, older people really do like this form of conversation. Quite apart from the fact that they don't have to travel and get tired going to see the specialist, they find this a really comfortable way of interacting with a health professional.
When you have a well-coordinated service between two sites, then we've found that actually you take less time to manage patients. Patients need less sessions, and the duration of time that you're seeing patients for a session is less. And this actually results in more time efficiencies for the patient and also cost savings for the health service, and overall more consumer and clinician satisfaction.
You no longer require expensive hardware to participate in a telehealth consultation. In many cases, a smartphone with a reasonable camera and internet connection can be used for a video consultation or to share clinical information. Of the millions of outpatient appointments being reported throughout major hospitals every year, it's important to consider the potential of telehealth as an alternative method of engaging with patients.